Everybody. It's a snow day today, so one more reason to stay safe and stay home. Wanted to give you an update over the last few days. First of all, in terms of the numbers, we've gone from 327 tested positive to 415 tested positive. We've had now 10 fatalities, 2 more fatalities. Tested a total of 4,500 people. That's 900 more since yesterday. So as you can tell, we're ramping up our testing. So the number of positives reflects testing as well as the infection rate. But it's worth thinking about this as I have before in terms of supply and demand. And the supply, first of all, is our healthcare supply, our capacity to take care of the number of people who are sick today and what we anticipate over the next 3, 6, 9 weeks. And if you look at those numbers, we've heard some startling statistics that we tend to double the number of people who are infected every 3, 4 days. And that gives us an idea of what our capacity is going to be looking like over the next 4 weeks. Our estimate right now is that about 15% of the people who do get infected end up being hospitalized. Of those who are hospitalized, maybe 5% end up in intensive care. One bit of good news, because Josh and I were on the phone yet again with all the leaders of the hospitals. Right now it looks like the amount of time one spends in the ICU is maybe 2 weeks, where in China it tended to be 4 weeks. I'm looking for good news, and that may be one way that we can add a little bit of capacity to our ICUs. As we continue to think about capacity, we've been working with the hospitals, and there are 3 main buckets, again, where we're trying to focus. And we've tried to make some progress. I got to say the hospitals have really are working at warp speed. Unfortunately, the virus is working at warp speed as well. But number one, we have to look at in terms of facilities. How can we get more beds? How can we get more space? And we've now prioritized 2,000 nursing home beds that we think over the next month or so would be made available for COVID-related infections as needed. We've got a couple of mobile field hospitals that have already or are about to be deployed. One in Danbury Hospital, the other right here at St. Francis Hospital. Working with our colleges, a lot of the students left on fairly short notice, and we've got moving vans coming up to some of those dorms now. So we're beginning to prepare to clear out those dormitory rooms so they will be available as extra capacity for intermediate care patients once they're out of the hospital, out of the ICU. And of course, we're beginning to negotiate with the hospitals as we try and find extra capacity. When you think about capacity, there are things we can control, things we don't control, and we're working really hard in terms of making sure we have the additional space and occupancy to deal with what we got to do. We've got the Army Corps of Engineers. I'm told it's going to be coming up in the near future. I'd love to see it. We were on the phone today with FEMA. I'd like to think that FEMA is going to put a little new energy behind the federal response. But, rooms and facilities is only part of the solution, because that doesn't make any difference unless you have the equipment and the gear and the people necessary to take care of what you got to do. And we're working hard. Josh Jabal, DAS, a lot of his purchasing team is now devoted to going after PPE, the protective equipment we need, going after ventilators, chasing down sources and opportunities around the country and further afield than that. And if the federal government doesn't want to do this on a unified, centralized basis, Connecticut is now teaming with other purchasing from around the country as an association, so the states will go out and try and buy and source as much of the important PPE equipment as we can get, because we are running short. We're looking at ways that we'll be able to retrofit things like commercial ventilators and the such, so we can, again, increase a little bit of capacity as we need it. Some ventilators, maybe we can get 2 people as opposed to 1 and find a way to retrofit that so we can increase the capacity of ventilation, because that is so key to our folks, especially in and out of the ICU. We continue to press hard with the federal government. We're on the phone again today, all the governors with the Pence task force team, and I try and remind them at every chance I can that, you look at the numbers in New York and say New York is going to get priority in terms of PPE and ventilators and masks. And I just urge them, don't think in terms of New York, think in terms of the hot spots. Think in terms of where the COVID is most intense, and that is New York City, Westchester County, and Fairfield County. That is a hotspot region, and you ought to think of it in terms of prioritizing that region, not prioritizing one state over another. Another bit of good news, I think, as we try and expand capacity, a number of our hospitals have been really aggressive. At not doing any non-urgent surgeries. That has freed up 30 to 40% capacity in a few of our hospitals. I'd like to see that continued. And that's capacity in terms of beds, that's capacity in terms of nurses, and that's capacity in terms of gear. So that's really good news as we try and plan for what we did. Look, we asked the hospitals, we told the hospitals, we directed the hospitals, I want to see 50% increase in capacity. Show us how you're going to do it, over the next 4 weeks. And we are getting there. And show me what you can do yourselves, not say, I just need more from the federal government. That's the supply side of the equation. Obviously, the demand side of the equation is probably even more important. As you found looking at experiences in different countries, anything we can do to flatten the curve makes an enormous difference. I'm not going to recite the things we've done in the past, but as you know, starting at 8 o'clock this evening, we're going to be closing those non-essential business. Those non-essential people don't have to go to work. And Connecticut and New York announced that on Friday. New Jersey announced their similar protocols the same day. Massachusetts announced it just today. And I've got David Lamont here. We can talk through essential and non-essential, but I do urge people to use their judgment. And I'm thinking about it in this way. I mean, why clothing and not hardware? And to me, a hardware store, you need a wrench, your pipe is burst, you got to fix it. That's an essential activity where you probably ought to be able to get access and you need it. Clothing, say, I think you can get that online. We're trying to do anything we can to discourage people from aggregating in big and small groups up and down Main Street. And that's part of what I was thinking about. Is 50 people is your max or 10 people is your max? Look, we've set a stage, it's 50 people. A lot of our towns have said smaller, it's 10 people. But just think realistically about it. Obviously, it's a big auditorium like we are here, and we're spread out. 50 is an appropriate number. If you're in a small coffee shop and you're waiting in line, 5 may be too much. So I can try and dictate as much as I can in the order, but I urge you to use your common sense and do everything you can to stay out of groups, large and small. And if you're over 70, stay home. Beaches. I mean, I've seen a lot of folks are closing beaches and the such. And I understand. I've seen some of the crowds at the beaches at Greenwich Beach, not to mention down in Florida. I understand the need there. What I've asked Katie Dykes to do, who runs our state parks, is try and cap the number of cars going to our state parks. Let's get some volunteers to tell people to keep their social distance. I'm trying to do everything I can to make it possible for you to be able to take a short walk with your family outside as long as you keep your distance, as they say. Every town's going to figure this out in their own way, but I just wanted you to know how I thought about what we're trying to do. Senate still hasn't reached a resolution. They're going back and forth. And obviously, our economic response is in part impacted by how they want to go forward. I can tell you, our meeting with all the governors, they were united on one thing. Give the governors a block grant. Give the governors the opportunity to invest the money coming from the feds in the way that we know it's most applicable. We would probably focus more on hospitals and less on cruise line bailouts. We know what we need in terms of unemployment compensation. We know what we need in terms of Medicaid expansion. We know those are the priorities we've got. I think the governors working closely with mayors and first selectmen, that's where the rubber meets the ground, and I hope that that's where the Senate ends up. Look, I'm so proud of Chris Murphy. He's pushing a bill right now. Small business, I come out of small business. I know the pain small business has. Their revenues are disappearing. They still got those fixed costs. And Senator Murphy is pushing a bill which I really hope gets through, where there's a forgivable loan to small businesses that do not lay off people over the next 4 months or so. And that's just the type of thing that allows a small business to power through this COVID crisis. It gives us a better chance on the backside of this, to hit the ground and get this economy back going again. And one last thought on thinking about the day after, because I've got an amazing group of people dealing with this crisis every day. But the day after, I still think about our kids. And I think about our kids, hundreds of thousands of kids who are at home missing what could be, months of education. I know that we had said we'd probably have to make up our mind on the schools, and maybe it'd be a couple of weeks. I regret to announce, I think we're going to push off that date where they could possibly open at the earliest to April 20th. And that made Miguel Cardona, our commissioner, and myself think, what can we do for these kids now? I do not want to lose a semester. And so Jan Hockadell and I were at the Connecticut Partnership this morning. That's the partnership between the state and the Dalio Foundation. And really pleased that we've been able to negotiate 60,000 laptops for our high school students. 60,000 laptops at virtually no cost to the state of Connecticut. Laptops are going to mean that not just the suburban kids from wealthier areas, but all kids can have an access to online learning and education. Start with Khan Academy, start with Google Classes, start with a lot of free content that is out there right now, doing everything you can to make sure this is not a lost semester, but an opportunity to reinvent yourselves and reinvent education. Jan's been telling me how at high school as well as K through 12, the teachers are really seizing this opportunity. They're starting up, town halls, telephone conferences with their students as a way to keep them engaged, keep them focused on what we've got to do. And that's what part of this announcement is with the 60,000 laptops. We're also working with Verizon and AT&T and Altice and Frontier and all the other cable providers because and they've been incredible. They said, look, they are going to offer free Wi-Fi in their hotspots to anybody, whether you're a subscriber or not. They said they're going to lift the data caps with all the telecommuting going on right now, make this easier for young people to find this affordable. So not only do you have your laptop, but now you have your connectivity. And every day we're working on amazing content to bring education alive to you remotely. And they're going to be expanding internet access to some of those areas that probably don't have very good connectivity. We're not going to let this period be a loss for our kids. And so, with that, I just want to say, working with the hospitals, working with small business, working with our mayors and first selectmen, working with the legislature on both sides of the aisle, working with each and every one of you, encouraging you to do the right thing, the sensible thing, use your judgment, stay home if in any way possible. We're going to get through this crisis, and we're thinking about the next day as well. Thank you, everybody.
Numbers, 415 positives, 10 deaths, 4,500 tested. What can we extrapolate from those numbers? What are they telling us?
Matt, go to the microphone so everyone can hear your question.
The current numbers, 415 positive, 10 deaths, 4,500 tested. What are those numbers telling us? What can we extrapolate from that?
Hi, my name is Dr. Matthew Carter. I'm the state epidemiologist with the Connecticut Department of Public Health. As I've described before, we are actually only measuring the tip of an iceberg. And the real question is, that's the most seriously ill people, the people who are hospitalized, the people who've been tested. No one knows how big the iceberg is under the water, so we can only make estimates. I said last week that for every confirmed case that we have, there are hundreds of people out there. I would assume at this point, I think last week I used the term 3,000 to 6,000. I still think we're at least in the thousands range, because that's, based on my experience, similar with what we would see with influenza at this time. It is expected that for planning purposes, the way I think about this, in an average influenza season, which usually runs from October to April, 10 to 20% of our population gets sick. And that's those numbers, if you do the math, are a lot of people in Connecticut will get sick during this first wave, and we can expect the number of hospitalizations to run in the thousands, and the number of deaths will probably be much greater than what we see in an average flu season, which is somewhere between 300 and 600. But we're just at the beginning of this. The influenza may not be the perfect model because we've never had a coronavirus pandemic before, so we don't know for certain. A lot of people ask me to make predictions similar to what you said. I think at this point in time, it changes every day. It depends on the number of tests that are done, the criteria for testing that are done. But the one thing that continues to go up is the number of hospitalizations. It's important to remember that in Connecticut, we are at different places. It's called, you think of an epidemic as having a curve that goes way up and comes down. This is still the acceleration phase where it's accelerating. As the governor said, the number of cases will double every 3 to 5 days. We'll be at a very different place a week from now. You've seen the events in New York City, how much has changed just in 2 weeks. And same for us. It was 2 weeks ago Friday, this past Friday night, that Governor and many of the staff here were standing in Danbury Hospital announcing their first case. So it's only been, 17 days? For many of us, it's hard to remember before that at this point. So what's good in terms of right now, remember, the reason why we put in these measures, social distancing, mitigation measures, is to slow this down. And the reason we're slowing it down is so that we can prevent our healthcare system from being overwhelmed. That's the key. And I think the governor mentioned good numbers in terms of that, making beds available, space available for what we know is coming. We can't see it, it's in the distance, but more cases are coming, more hospitalizations are coming. And we want to make sure that for every person who needs to be in a hospital, who needs to have oxygen, maybe they need an intravenous line because they need fluids, we'll be able to find a bed and receive the treatment that you can only get in a hospital.
If you could do the math for us, at the rate of growth, at what point will the hospitals be at capacity, and at what point will Connecticut need to have those mobile hospital units and other extraordinary things online?
Actually, I heard that question asked on a conference call with the Centers for Disease Control this afternoon, and they said, we hope to have the answers to those questions in a few days. And I don't think I could do any better than the CDC at this point in time in predicting. I think we just don't know. Obviously, we're trying to put in the measures to slow it down. I mean, if I could think of it as a pause button, I would love to just reach out and press the pause button until we had enough testing capacity, until we had all the PPE we need. I just don't know how long we've slowed it, but you need to remember this virus does not share our sense of time. And I'm actually pleasantly surprised that Hartford and New Haven County aren't more impacted yet.
A sense of what would be the best practice at this point on testing versus what you can do because of the availability of testing kits? Okay.
Well, our first priority continues to be to test people who need to be hospitalized, because that's critical for hospitals to be able to use the personal protective equipment that they have in the best way possible. That's really critical here, is that the supply of personal protective equipment, PPE, is limited. And you may have read in the papers that there are hospitals not too far from us who are already being forced to reuse N95 respirators. These are things that we never thought we would see in the United States, but we're being forced to that position right now. The key is hospitalized patients first. New York City put out an announcement yesterday saying they were discouraging all testing except for hospitalized patients, because They need to focus on this huge wave of patients that they're expecting. We are not at that point yet, but if you think about where we put those alternate testing sites, we asked our acute care hospitals to set them up because people were going to hospital emergency departments to get tested. So from public health perspective, we wanted to make sure that those people didn't go in the emergency department door. And that's why they are where they are. They're not in a CVS or a Walmart parking lot, but it's all part of the strategy to protect the hospitals.
I have a question for the governor. Governor Lamont, does the state of Connecticut plan to continue releasing the unemployment numbers?
Hadn't thought about it, but why wouldn't we? Hadn't thought about it, why wouldn't we?
You talked about the executive order that's coming down tonight at 8 o'clock. As we went around to different towns and went to different strip malls, it was hard to find a business that would have to close under this order. Either it's a salon or a bowling alley that's already closed, or they're exempt. There are hundreds of businesses listed as being exempt. Is it possible there are too many exemptions and this won't do anything to flatten the curve?
I'm going to talk about it broadly, then I'm going to ask David Lamont to talk specifically. Look, the biggest building blocks of our economy, you're right, a lot of those are not being touched by this order. That starts with manufacturing. A lot of manufacturing is in the defense sector where by law they have to keep operating, and some is not in the defense area, and we've decided to keep that going. The reason I've decided to keep that going is because it's a contained area and we can control the people who are going in and out. We can give them fever tests. We can make sure they're least likely to be infected. And believe me, every CEO of these companies is doing everything they can to monitor that because the last thing they can have is an infection there. And you talk to EB and Pratt and Sikorsky, they're very careful with their folks back when they're at home as well because they know what that would mean. Next is construction, another big building block of our economy. But also when you're outside and you're building a bridge and you're building a school, which is on a time frame, we're asking the construction folks to use very careful, social distancing and work along those ways, but keep going. Next biggest building block, of course, is healthcare, where that's can't be touched. I'll ask David maybe to talk a little more about the service industry, since I think that's an area where, just by definition, fewer people are already going to those places. Those are places where a lot of people do tend to congregate, and that's probably the sector that will be most impacted.
Thank you, Governor. Yeah, I would just underscore that point. I think there was a big focus on, especially where there is offices where there are significant amounts of people, to the extent that they're not already telecommuting or able to work from home, that we mandate that and we make sure that those offices do shut. To your question about retail and strip malls, I think it was important that we offered some of those businesses an option if they wanted to do curbside pickup or sales over the phone or the internet. Given the density of Connecticut and where we are right now, we thought this was an alternative for them as opposed to completely shutting the doors. This was a way to do it prudently, making sure public health was the focus, but also enabling the businesses to do some type of business should they want to. I do want to make one point. It is important, even for businesses, and I've had lots of these conversations over the weekend, for businesses that are deemed essential, for their non-critical employees, they need to be working from home. They need to be telecommuting, if at all possible, or staying from home. And if someone absolutely needs to be, whether it's in an office or in a factory, that there are protective measures in place. Everyone's doing incremental cleaning. The spacing needs to be appropriate, and making sure that the health measures are embraced for folks that are in the office. I've been urging all employers to do that, and I think it is critical to make sure that people are safe as we keep navigating this crisis.
There were other businesses, a pawn shop, a cell phone shop, and a vape shop. They all said, we don't know. We're trying to do our research and we don't know whether we're supposed to close tonight or not. So are you communicating effectively? How are you getting the message out to those types of businesses?
So we've had lots of questions over the past 24 hours and over the weekend. If you look at what we put forth, we looked at lots of other states as well as a lot of the federal guidance for critical industries. We have an exception or an exemption process that's in place at the DECD website. I think we've had several hundred requests for exemptions that the team is processing at this point. And the goal is to make consistent recommendations across some of these industries. And if we ultimately need to change the guidelines as we navigate the crisis, we will.
Just Governor, how do you balance patient privacy with the public's need to know, there's a shelter in New Haven, you released there 2 positives and possibly a third, and that New Haven is not releasing the name of the shelter. People in the neighborhood would like to know what they have in their neighborhoods.
Have any insights on that, Josh?
Cases of COVID-19 infection are reportable in Connecticut to state and local health departments. We have in our statute and regulations provisions for confidentiality of that information. And individually identifiable health information can be released if there is a public health need to do so. I don't know the specifics of what you're talking about, the specific case, but I can tell you if you look back at the past few weeks, we've named nursing homes, other places where people have become infected, because from a public health perspective, in a pandemic, I think we have to take a different approach to this in the sense that part of our responsibility is not just to protect confidentiality, but it's also to make sure that we don't create fear and panic in a community when they don't know. And for example, the nursing home case, if we didn't name the nursing home, everyone would think that it was the nursing home where my relative was. And so there is a public health need in a pandemic to be more specific to allay public concerns that are real concerns. I hope that answers your question.
What are the prospects of a further tightening of the restrictions on commerce and social life at this point?
It's a possibility. Look, we've tightened up the spigot a little bit every few days. And I continue to coordinate with all my fellow governors. We continue to watch this pandemic as it spreads and accelerates. But most importantly, I try and do everything I can by urging people to do the right thing. And if we find at the end of 3 days everybody's still congregating in congested parts of the parks, or everybody's crowded at a pawn shop, we'll make additional changes.
Do you anticipate an impact on hospitals in Fairfield County, Greenwich Hospital, Norwalk, and so forth? In other words, from the New York cases, I mean, they're already at 20,000 cases, most of them concentrated in Metro New York.
What's the question? What's going to impact those hospitals?
Do you anticipate the New York cases impacting on the Connecticut hospitals in Fairfield County in particular?
Yeah, I can tell you at Greenwich Hospital, there are a lot of New York cases that are going there right now, if that's part of your question. We have to watch that pretty carefully. And also, let's face it, New York City is a bit of a canary in the coal mine. And what you see in New York and Westchester and Fairfield County, as Dr. Carter said, we want to do everything we can to slow that down so it doesn't impact the rest of the state, at least at the same speed.
How does that factor into the math you've been trying to do, or trying not to say here today, on at what point will Connecticut hospitals have a capacity issue?
Well, right now, the first hospitals that will have capacity issues are Greenwich, Danbury, Bridgeport, Norwalk, the hospitals that you were talking about. They are all making adjustments as we speak to their room availability, their structures where they can. They're going to expand their ICUs. Those are all things that they're doing. And right now, they're still holding their own.
This is probably for Josh. As far as using dorm rooms for beds, how many, and how do you decide which schools are going to be involved in that?
So this is part of what, so I'm Josh Jabal, Chief Operating Officer. This is part of what the governor alluded to earlier. We're in constant dialogue with the hospital executives as they're looking at their surge capacity. They're making very aggressive plans, as the governor and Dr. Carter mentioned. And then we're working with them on, where there may be gaps as we look at the demand forecasting and think about where additional capacity might be needed. As the governor mentioned, the best source of additional capacity is the hospitals themselves. They have the equipment, they have the staff, and they're being very creative about how they're rearranging a lot of their own facilities to make room. The next best thing is likely to be, as the governor mentioned, additional nursing home capacity. Either we have a lot of nursing homes that have been recently closed, or where we have a wing of a nursing home that might be vacated, and thinking about ways that we can utilize those. Again, where we have infrastructure in place and staff at the site potentially. And then we go from there to sites that are not necessarily fit for purpose for a medical use, but that could be spun up in pretty short order for that need. And so that's where we get into the dorms, we get into some other state facilities that we're looking at, and we get into some of the mobile units, both the state-controlled ones that, as the governor mentioned, we're in the process of deploying now, as well as FEMA resources that we're surveying the hospitals to see if they'd like us to call in on their behalf as well.
Involved, depending on where that goes?
Yeah, we have a very long list of sites that could be potential assets in this.
Regarding the hospitals, I mean, have they said when they're not necessarily resources, but financially with the funding of the hospitals?
Look, the hospitals have awful lot of demand right now. Awful lot of overtime. They're not making any revenue off of elective surgery, which is sometimes a revenue stream for them. So absolutely, we're going to have to find a better way, a good way, working with the feds, I hope, to bolster them and make sure they stay solvent and help power through this, just like a lot of our small businesses. I'll tell you, Mark, everybody says, what's the timing and when do you hit capacity? What's going on? What are the big variables? The variables are we continue to expand capacity as best we can, as we described. We're finding a little bit of good news, as Dr. Carter represented, that perhaps outside of Fairfield County, we're able to slow the demand a little bit, if not more than that. So in the timing of this, slowing of the demand, number of people have to be in the ICU. These are all variables we're looking at carefully to see whether we're 3 weeks, 6 weeks, 9 weeks, or we can get through this thing in a reasonable period of time. I also thinking about the next day, though, and I'm looking at what's going on in Asia right now. We look what happened in 1918, where we took our eye off the ball when we thought, oh my gosh, it's July, not as many people getting infected. And, 4 months later, you saw some infections creeping back again. So we're thinking long and hard about how we get through this potential surge, and more importantly, how we keep Connecticut safe for the foreseeable future.
The state parks, Sleeping Giant was filled to capacity over the weekend. You said Katie Dykes is going to curb the amount of cars allowed in. Can you give us some specifics about how much of a reduction you're looking for, and is it at every state park?
I think it's every state park. I think we ought to be consistent. Some of the parks are loved to death. Some are, I took a little walk. It was very private. I loved it the other day. In terms of those numbers, let me talk to Katie about it. But obviously, people have got to be clear. When I was taking the walk with Andy the other day, there were clumps of teenagers. Maybe it wasn't a crowded park, but every once in a while you'd see 6 kids walking in a very tight group. You just say, maybe it'd be better if you could just stay a little bit apart from each other. Parks aren't too small, the groups are too tight.
Do we have any indication on the amount of recoveries that we've seen so far in our state?
Do you have that information on recoveries? I think we got to get back to you on that, sorry.
Or how long it takes? Like some good news, we're looking for how long it...
Well, I can start. What I told you is what I heard from the hospitals today, so it's fresh information, is where perhaps in China you were spending 4 weeks in the ICU. We're spending maybe 13, 14 days. You're not out of the woods at that point. Maybe you go to an intermediate clinic. Maybe you go to one of the nursing homes we're retrofitting. There are a variety of things we can do. But I think you're going to find we have an amazing hospital system. I think you'll find our cure rate is better. I think you'll find our cure rate is faster. And certainly for younger people, people under the age of 50, people younger than me, for 90+% of you, it's going to be like a bad case of the flu. Everybody else, stay home. Thanks, everybody.
Really briefly, we're doing around 1,000 tests per day, but we're hearing that there's a slow turnaround for the results of those tests. What can be done to kind of speed that up?
I'm not sure where you're getting the 1,000 number from, but what I will say is this, is that we are receiving electronic reports from the laboratories that can report to us electronically. Those go right into our database at the State Health Department. There are still laboratories that are reporting to us by fax and by paper using old technology. Those need to be manually entered into our system. We also have now 5 or 6 different labs that are testing, and so we're not getting timely results from all of those labs as of yet. But if you look at the data that we're posting today on the state website, we were posting a daily summary of the data. There'll be two graphs that I'd like you to take a look at. One is test positives, people who test positive by age group. And we're adding a new one, which are people who've been hospitalized with COVID-19 by age group. And what you'll find is that we're actually testing a lot of people. Our overall what's called the test positive rate is around 12%. So for every 10 people that get tested, 9 are negative for COVID-19. Only 1 is positive. So we're going through a lot of tests to get that one. The second is that most of the people who are getting tested are in their 30 to 50 years of age range. The people who are being hospitalized with COVID-19 are more like 50 to 80. So most of the tests are going to people who are much younger than the people who are at greatest risk for this disease. So I don't know when that will be available to the media, but a little later today. Take a look at that.
How about that test that they can turn around in 45 minutes? Any truth to that?
Oh, sorry. The governor is asking me a question. Is that there is a test that's been approved by the FDA. It's by Cepheid. It's a company. It is available in 45 minutes, but the problem is it's about 5 samples per hour. So it's one of these things that could be used in the hospital to give a quick answer. You have a patient you need to know really quickly, but it's not going to yield a large number of test results in the course of a day.
Is the testing limited by the kits that the state received from the CDC? In other words, do all these tests have to be done with the swabs and other collection material that came from the CDC, or do these drive-up places at hospitals, they can provide their own, sterile swabs and tubes and whatnot?
Well, that's a good question. There are shortages in every part of this process right now. There are shortages in what's called the viral transport medium that the swabs have to go into. There are shortages in the number of swabs, a global shortage, and CDC has come up with some alternatives to that. So the medium, the swabs, the test kits are still limited. No matter what, you still have to get a swab taken. Usually a nasal swab is what's recommended. Those are all in short supply. And for every person who's tested as an outpatient, that also, and this is the term that medical people use, burns PPE. It uses up personal protective equipment. And so, as I mentioned earlier, New York City has decided to actually discourage outpatient testing because it's using up too much personal protective equipment that is required in the hospitals. So all of these things are presenting challenges all the way along the supply line.
I know it's a hard message to deliver, but are we, in some senses, over-testing in the fact that there are younger people who might be running a fever and having a cough, and they're being tested? Should the message be hold off a little bit?
Well, we've recommended that people who have a fever and a cough and who have other symptoms like a really bad flu at the present time should assume that they have COVID-19. It's possible they could have influenza instead because influenza is still around. But a lot of people were going to emergency departments to get tested and requesting tests. So we've tried to create a balance. But if it comes to the point where personal protective equipment needs to be even further rationed, we will need to ration it for patients who are hospitalized and the people who take care of them, and discourage outpatient testing.
Use the alert notification system again to get your message out like you did this weekend. I understand the website crashed. Some people weren't sure what it was and they thought it was a scam and they didn't want to click and open it up. I don't know if you're working.
Well, the telephone alert, I just wanted to do anything I could to stem a lot of rumors that are out there. And I wanted to tell everybody what I meant by stay safe and stay home. I wanted to tell people, especially young people, to take this seriously. There's a balance between panic and seriousness. I want these people to be serious about taking the necessary social distancing. And I've tried to do that through press conferences. I tried to do that through TV shows. And I thought this was a new medium to try it. I did it through streaming video as well as the telephone. I don't know. What do you think?
Can we count on you for a daily briefing like this one, even on the weekends, from you or maybe someone else in your administration?
I think we're going to keep doing briefings. It's probably important to have something to say. But as long as people come and have curiosity, because this is such an ongoing thing that's changing so fast, I think we're going to err on the side of doing too many briefings. But not too long briefings. Thank you, everybody.